Good day everyone and Assalamualaikum. I am Hamsida H. Abduraja. Today I am going to discuss the influenza or flu disease. Influenza, also known as flu or grippe, is an acute inflammation of the nasopharynx, trachea, and bronchioles with congestions, edema, and the possibility of necrosis of these respiratory structures. Influenza is a highly contagious infection of the respiratory tract caused by three different types of virus influenza. It occurs sporadically or in epidemics which peaks usually during colder months. About the disease. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it's not the same as stomach flu, virus that causes diarrhea and vomiting. The incubation period is 20 to 48 hours. Symptoms appear approximately 72 hours after contact with the virus, and the infected person remains contagious for 3 days. Influenza is usually a self-limited disease that lasts from 2 to 7 days. The disease also spreads rapidly through populations, creating epidemics and pandemics. Annual estimates are that approximately 20,000 deaths occur as a result of influenza virus and 250,000 to 500,000 new cases occur each year in the United States. Disease process. Influenza virus attachment to the cell membrane, then it goes to the influenza virus replication, productions of cytokinesis, granenzyme, and cytotoxic factors, then it fast to the serine protease inhibitors. Then it causes the airway inflammation and alveolitis. Thus, it damages the airway epithelial cell and endothelial cell, airway hyperactivity and narrowing, and it also damages the alveolar epithelial cell and endothelial cell. Then, it causes the pneumonia or ARDS and exacerbations of the bronchial asthma and COPD. The pathophysiology of this. The primary mechanism of the influenza pathophysiology is the result of lung inflammation and compromise caused by the direct viral infections of the respiratory epithelium combined with the effect of lung inflammation caused by immune responses recruited to handle the spreading of virus. Mode of transmission. Influenza virus shedding, the time during which a person might be infectious to other person, begins the day before symptoms appear and virus is then released between 5 to 7 days. Although some people may shed virus for longer period. People who contract influenza are most infective between the second and third days after infection. The amount of virus shed appears to correlate with fever, with high amount of virus shed when the temperatures are highest. Children are much more infectious than adults and shed virus from just before they develop symptoms until 2 weeks after infections. Influenza virus may be transmitted among humans in 3 ways. First, by direct contact with infected individual. Second, by contact with contaminated object called fomites such as toys, doorknobs, and third, by inhalations of virus-laden aerosols. For the pathology, we have the inflammations of the upper respiratory tree and trachea, high fever, cough, malaise, and coryza. For the symptoms of disease, we have runny or stuffy nose, headache, cough, diarrhea, sore throat, and muscle or body ache. Causes. Influenza virus travel through the air in droplets when someone with infections, cough, sneezes, or talk. You can inhale the droplets directly, or you can pick up the germs from an object, such as telephone or computer's keyboard, and then transfer them into your eyes, nose, or mouth. For the complications of influenza virus, we have the bacterial pneumonia, ear infections, dehydrations, sinus infections, worsening of the chronic medical conditions, congestive heart failure, asthma, and disease. For the assessment findings, during the physical examinations in a patient with influenza, findings can include fever, tachycardia, tachypnea, sore throat, and fatigue. Complication can worsen the patient's conditions, and finding in the lung examination may include dry cough, rales, and focal wheezing. Rapid diagnostic tests for influenza can help in the diagnosis and management if patients who present with signs and symptoms compatible with influenza. They also are useful for helping to determine whether outbreak of respiratory disease, such in nursing homes and other settings, might be due to influenza. No specific diagnostic tests are used because diagnosis is made by the history of symptoms and onset. If patient has symptoms of a bacterial infections that complicates influenza, cultures and sensitives may be required. Priority nursing diagnosis, we have ineffective rating pattern related to inflammations of viral infections, infection related to the presence of virus in mucous secretions, acute pain related to coughing, hyperthermia related to exposures to infections, ineffective airway clearance related to pneumonia, and deficient knowledge related to lack of knowledge about the disease process influenza. While the nursing interventions, administer analgesics, antipyretics, and decongestants as ordered. Follow droplets and standard precautions. Provide cool humidified air but change the water daily to prevent Pseudomonas superinfection. Encourage the patient to rest in bed and drink plenty of fluids. Administer IV fluids as ordered. Administer oxygen therapy if warranted. Regularly monitor the patient vital sign, including his temperature. Monitor the patient fluid intake and output for sign of dehydration. Watch for signs and symptoms of developing pneumonia. Advise the patient to use mouthwash or warm saline gargles to ease sore throat. Teach the patient the importance of increasing fluid intake to prevent dehydration. Suggest a warm bath or heating pad to relieve myalgia. Review prevention of future influenza episodes with the patient and the community. For the prevention, vaccination, the influenza vaccine is recommended by the World Health Organization and United States Center for Disease Control and Prevention for the high-risk groups, such as children, the elderly, healthcare workers, and the people who have chronic illness such as asthma, diabetes, heart disease, or immunocompromised, among others. We have two prevention. The first one is the flu shot, is an inactivated vaccine containing killed virus that is given with a needle. It can be given in the muscle or just under the skin. The flu shot that is given to the muscle is approved for use in the people older than 6 months, including healthy people and people with chronic medical conditions. The flu shot is given below the skin is for those 18 to 60 years old of age. The second one is the nasal spray flu vaccine, is vaccine sometimes called live, for live attenuated influenza vaccine, made with live weakened flu viruses that do not cause the flu. Live is approved for the use in healthy people 2 years to 49 years old of age who are not pregnant. For the medical intervention, people with the flu are advised to get plenty of rest, Drink plenty of fluids. Avoid using alcohol and tobacco if necessary. Take medications such as acetaminophen, paracetamol to relieve the fever and muscle aches associated with the flu. Children and teenagers with flu symptoms, particularly fever, should avoid taking aspirin during the influenza infection, especially influenza type B, because doing so can lead to Ray's syndromes, a rare but potentially fatal disease of the liver. Phenylephrine and antitussive agents such as terpene hydrate with codeine are often prescribed to relieve the nasal congestion and coughing. A patient with influenza that is complicated by pneumonia, antibiotics may be administered to treat a bacterial superinfection. For the infection control, reasonably effective ways to reduce the transmissions of influenza include good personal health and hygiene habits such as not touching your eyes, nose, or mouth, frequent hand washing with soap and water, or alcohol-based hand rubs, covering cough and sneezes, avoiding close contact with sick people, and staying at home yourself if you are sick. For the pharmacological treatment, we have the antiviral medications may be effective, but some strain of influenza can show resistance to the standard arrival antiviral drugs, and there is concern about the quality of the research. Oseltamivir is an oral medication. Zanamivir is an inhaled through a device similar to an asthma inhaler and shouldn't be used by anyone with a certain chronic respiratory problem such as asthma and lung disease. Phenylephrine and antitussive agents such as terpene hydrate with codeine are often prescribed to relieve the nasal congestion and coughings. In patients with influenza that is complicated by pneumonia, antibiotic may be administered. Neuraminidase inhibitors, oseltamivir, and zanamivir for use in the treatment and prophylaxis of influenza A and B. Rimantadine for the treatment of prophylaxis of influenza A only. Antiviral treatment should be initiated within 44 hours of symptoms. Risk factors. We have risk factors associated with these conditions. We have age. Influenza target children is 6 months to 5 years old and adults 65 years old or older. We have living or working conditions. People who live in or work facilities with many other residents such as nursing homes or military barracks are more likely to develop the flu. People who are staying in the hospital are also at higher risk. Weakened immune system, cancer treatment, anti-rejection drugs, long-term use of steroid, organ transplants, blood cancer, or HIV/AIDS can weaken your immune system. This can make it easier for you to catch the flu and may also increase your risk of developing complications. Chronic illness condition including lungs disease such as asthma, diabetes, heart disease, nervous system disease, metabolic disorder, an airway abnormality, and kidney, liver, or blood disease may increase the risk of influenza complications. Obesity, people with body mass index of 40 or more than have increased the risk of flu and complication. Pregnancy, pregnant women are more likely to develop influenza complication, particularly in the second and third trimester. Women are more likely to develop influenza-related complications up to 2 weeks after delivery of the babies. For the recommendations, what should do and what should avoid. So alcohol is an effective sanitizer against influenza viruses, while quaternary ammonium compounds can be used with alcohol so that sanitizing effect lasts for longer. Drink plenty of liquid, choose water juice and warm soaps to prevent dehydration. Rest. Get more sleep to help your immune system fight infections. You may need to change your activity level depending on your symptoms. For the don'ts, smoking raises the risk of contracting influenza as well as producing more severe disease and symptoms. Avoid crowded to any places. That could be all. Thank you.